Imagine you wake up one morning on a day like today feeling really tired. Now, I know that's never happened to anyone here today. You reach over and you grab your smartphone, and there's a text message from your doctor. She says, give us a call because the monitoring of several physiological parameters overnight have picked up some labored respirations and changes in your sleep pattern. So you pick up the phone, you speak to your doctor. She asks you to download an app onto your smartphone. You put your finger on the home button of the smartphone. It gives some readings to a central monitoring station, and a little bit later you get a follow-up call asking you to come in to be evaluated. You feel reassured because you know that early detection is the key to finding a problem and fixing it when the best outcomes can be achieved. Now, this scenario, and many others like it, demonstrate the indispensable role that technology will play in the future of healthcare. At Stanford Medicine, we have a vision for this future, and it's called Precision Health. Precision health is rooted in the energy, innovation, and future focus of Silicon Valley, and in the curiosity and audacity of Stanford. It's precise not because it's narrow, but because it uses all possible data points at hand, taking into account genetics, behavior, socioeconomics, and the environment, to provide care that is not one size fits all, but is one size fits one. And it's health, not medicine, because it maintains an unwavering focus on prediction and prevention, in addition to diagnosis and treatment. So why precision health and why now? Well, as Professor Maroy indicated, talk to any tech executive or entrepreneur in Silicon Valley, and the question they'll first ask is, what problem are you trying to solve? The problem we're faced with in healthcare today is that the healthcare system has traditionally been too reactive and all too often too late. The time has come to make it predictive, preventive, and proactive. The last decades in Palo Alto were about the information technology revolution. We believe the next decades in Palo Alto are going to be about the revolution in precision health. You could say that precision health actually began at Stanford many years ago when Paul Berg first recombined DNA from two different species, and then Herb Boyer and Stan Cohen used recombinant DNA to produce proteins. Both Paul Berg and Stan Cohen are still on the Stanford faculty today. And with the use of recombinant DNA technology to produce proteins, we saw the growth of companies such as Genentech and the production of products such as recombinant human growth factor. Cohen and Boyer recombined DNA, and today with precision health, we're recombining a broad range of elements into an unprecedented mix that addresses the healthcare needs of the whole person based upon his or her unique factors. We're creating new predictive devices and preventive tests. We're bringing physicians and patients together to empower patients and physicians in uniquely transformative ways. We're mastering data so that we can glean more information from huge data sets. And we're translating best practices, we're translating best ideas into best practices. Our work today is inexorably linked to and inspired by remarkable developments in technology in Silicon Valley. You know, it's an amazing statistic that it's estimated that in the year 2020, about 80% of adults on the planet will have access to a smartphone. That's going to change the way people can get data about their health and, when they choose, give us data about their health so that we can better understand how to treat and prevent disease. Each of us today probably has an ATM card that we can use at virtually any ATM on the planet. But it can be incredibly difficult to get our healthcare data from one physician or one healthcare system to another. We need to empower people and empower systems so that we can share data in ways that make understanding of healthcare information much more feasible. Virtual reality headsets have now fallen below the $100 mark. Virtual reality, I think, is going to totally transform medical education, in particular, education about procedures and training people in remote parts of the world in the same way that we train people who are actually on site at our facilities. And we're already seeing elements of this future today. With ClickWell, we founded a service, a platform, that allows patients to digitally interact with us and their healthcare providers. They can make an appointment. They can also request a telephone conference or a telemedicine visit, thus enabling people to get access to healthcare providers with very little lag time. Now, one of the amazing things about this is that when given the option, do you want to get all of your care virtually online, or do you want to still have a primary health care provider and have virtual care available to you when you need something on short notice? Almost without exception, people elect to have a primary care provider and to use the virtual experience when they need it for something urgent or a question when they don't want to wait in order to see a provider. We're developing ways that technology can and should affect health care. Here are just a few examples. A monitoring device that accurately predicts pediatric asthma attacks days before they occur. Cost-effective tests that predict the incidence and the likelihood of heart disease. And non-invasive blood tests based upon cell-free DNA technology that can diagnose cancer long before it's manifested in any other way. In addition to the work we're doing at our own institution, we're collaborating with others outside and inside of academia. We know how vital it is to work together if we want to move forward quickly. Let me just describe a few examples of those collaborations. With Apple, we rolled out an app called My Heart Counts. Over 50,000 people around the world have signed on and receive information about their risk factors for heart disease based upon parameters they enter and monitoring of their activity. And when they choose to have that data uploaded, it can be used in research studies, including, if they wish, to have that data linked if they've had their 23andMe genomic testing done in ways that lets researchers relate the genome with activity and subsequently with the risk for heart disease. With Google, we're championing big data in health in several different ways. One, through the Google Baseline Project that will, over the coming years, enroll 10,000 people, 5,000 in the Bay Area, 5,000 near Duke in North Carolina, in what will, we hope, be the most comprehensive longitudinal cohort study. Everything we can imagine about these people will be measured: genome sequencing, other omics, as well as the latest generation of wearable devices. This prospective following of longitudinal data will enable us to evaluate risk factors in a much more accurate way than we've been able to do in the past. You may have read a couple of weeks ago about the Chan Zuckerberg Science Initiative. One component of that is the founding of a biohub in Northern California. The biohub will receive support from, will have the engagement of faculty from Stanford, University of California, San Francisco, and University of California, Berkeley, directed at developing the technologies and the engineering solutions that will fuel this biomedical revolution that we're in. And with SAP, and I think you'll hear a little bit more about this from Steve Singh in a few minutes, we've used their connected health platform for developers and to bring together healthcare providers and healthcare systems. We've used it to develop a number of different applications in clinical genomic testing. And also, we used it to develop an app called Clinical Genomics Insights that won the SAP HANA Award, was a winner of the SAP HANA Award last year. So what do we need to do to make this vision a reality? Well, several things, but I'd like to talk about just 4 here today. One is we need to really consciously break down silos. I mentioned before the difficulty each of us can have in getting data from one side of town to another, getting our healthcare data. We need to provide the incentives, just like the financial services industry had to provide each of us with an ATM card that we could use at ATMs much more broadly than just the bank that we got it from. we need to be able to provide those same incentives for creating greater portability in data, in healthcare data, and in particular for getting the healthcare data in the hands of people so that they can use it to understand their health better and take more control in an affirmative way over their health. Consumer empowerment is going to be a key, I believe, to breaking down these barriers and data silos. Within academia, we need to focus more on being able to translate fundamental research to translationally driven research to actual care in patients. There are oftentimes silos that exist within those different areas, fundamental research, translational medicine, and clinical care delivery. We need to focus on breaking down those silos and facilitating the very best science getting into clinical application as soon as it possibly can. Data security has already been mentioned several times today, and I'm sure it'll be mentioned more. It's an astounding statistic that 47% of Americans last year had their healthcare data hacked. We have to ensure the security of our data, of our healthcare data. But we can't stop there. The NIH has funded the Global Alliance for Genomics and Health. This alliance creates a series of servers or beacons that brings together genome sequences of a large number of individuals. And it allows someone to go in and say, give me the genomes that have a variant at position 1074 on chromosome 1. As a group of Stanford scientists led by Carlos Bustamante in the Department of Biomedical Data Science and Genetics showed, it's possible to reconstruct a great deal of the genomic profile from searching the beacons in this fashion. Carlos Bustamante and his colleagues went on to suggest ways that risk can be reduced by combining data at earlier stages and by restricting the size of the genome that any given beacon can give out at any time. We have to look at how we train physicians and other healthcare providers. It's been shown that one of the main reasons physicians and other health providers don't recommend genomic testing in cases when we know it could be beneficial based upon known variants and known actionable variants. One of the reasons it's not recommended is that many times the physicians or healthcare providers don't understand the implications of genomic testing or how to interpret the results. After all, most of us were trained before the human genome was mapped. We need to create better educational methodologies. We need to make sure that at every stage of medical education, we're training people to be lifelong learners. And in the same way, and in doing that, we're also training our patients to understand the information that's available to them. Now, much of what goes on in the developed world with regard to medicine focuses on actually a very small proportion of the determinants of healthcare. This pie chart shows how health is determined. 5% from our genetics, 20% from medical care, 20% from behavioral factors, and 55% from environmental and social factors. Most of what we do in the developed world focuses on the genetics and the medical care. But we have to be looking more in the future at behavioral factors and at social and environmental factors. One of the things I've watched closely over the past few months is the adoption of Pokemon Go. It may seem silly, but there have been billions of dollars spent trying to get people to change their behavior and exercise more. And the beneficial effects of even a modest amount of exercise have been well characterized. But those attempts don't often achieve success. Pokemon Go, at least if you're not getting hit by a car crossing a street, is getting people to exercise and be active more. Who knows how long it'll last, but it's something to watch, and we may learn a lot about behavioral interventions in the future from what's going on with Pokemon Go. Now, this is the kind of innovation that the consumer technology industry understands so well. How to engage an individual in the most cost-effective way possible. And here are some examples we're pursuing at Stanford. Manu Prakash is an assistant professor of bioengineering. He's also a MacArthur Genius Award recipient. He's developed a microscope that costs 50 cents to make. It's assembled like an origami, and it can be widely and is being widely distributed in the developing world in order to detect infectious microorganisms. Here today, participating in this conference is Dr. Daria Moakley-Rosen. Daria and Dr. Kevin Grimes put together a program called SPARK that teaches students and fellows and faculty the drug discovery process. And in the first 9 years of SPARK, there have been 74 projects completed. Almost half of them have been commercialized, and many others have led to new utilizations of existing drugs for therapeutics. And the Stanford SPHERE, the Stanford Precision Health for Ethnic and Racial Equity Center, funded by the NIH, is looking at behavioral interventions such as obesity in Mexican-American children to determine what interventions might be effective and how we can improve health in that way. Now, today I've told you a lot about the transformative collaborations we formed with the tech industry and the opportunities we see for moving forward. But I want to leave you with one very important message. I believe that technology is going to be a remarkable enabler for the future of health and will be an enabler for precision health, enabling us to be more predictive, preventive, and proactive. But technology is just that, an enabler. In the end, it's the high-touch aspects of medical care and of each of our involvement with our health care that's going to make the greatest difference in the health of our planet moving forward. And I think to achieve that, it's going to take not only technology, but a lot of innovation and impact in social environmental factors and behavioral factors as well. Thank you very much.